Cool. The webinar has started, and Katie, it looks like it is already recording. So,
yay! All right, welcome. Welcome, Melissa. Hi, Cameron. Thanks for joining us. We'll give folks a chance to get on. Hi, Alicia. Yay! So we'll give folks a chance to get on here, and then we'll get started. So glad you're able to join us today. Hi, Abby. Hi, Roberta. Please feel free to introduce yourself in the chat box. Tell us where you're from in the country. That'd be great to see. We'll have a poll in a second about your role and position. All right. Should we go ahead and get started? Alex and Karen? Thumbs up?
sorry. Yes, thumbs up.
Awesome. Okay. So we'll go ahead and get started because we have a whole lot that we'd love to share with you today. And again, just welcome. Thanks so much for joining us. My name is Katie Abbott, and I'm an associate professor at Miami University in Oxford, Ohio. That's where I'm located right now. We've got a beautiful sunny day today. And we're delighted to share with you some resources from preference-based living. And specifically, we're going to talk to you about the Preferences for Everyday Living Inventory, or the PELI. And hopefully it can give you some guidance and help where you might need it. And so we'll ask you where you have some pain points in a minute. And so why don't we have Karen, why don't you introduce yourself next, and then Alex.
Hello, good afternoon. My name is Karen Ashragi, and I live in the Philadelphia area. I am currently the Director of Grants and Research at Abramson Senior Care, and just delighted to be here. And I have a ton of experience with the PELI, so I'm delighted to share some nuggets of information with you today and to learn how, to support you in your journey. Alex.
All righty. Thanks, Karen. Hi, everyone. My name is Alex Hepner. I am a senior research assistant at Scripps Gerontology Center, but there my primary role is to work with Katie on the amazing grants that she gets to help us essentially create all of these resources that we're going to walk through today and share. And so I help support those efforts. And also a big part of what I do is work directly with you providers on some of our quality improvement projects. We're going to touch a little bit about those resources as well. But yeah, so glad you could join us, and really excited to share all of our wonderful resources with you today.
Wonderful. So today what we hope to do is give you a little overview of the PELI. You may or may not be familiar with it, so that's what we're hoping to find out in a little bit, and then hopefully answer your questions. We want to discuss strategies for you if you're interested in starting to implement PELI in your organization. We also want to share our Compass software that we call Care Preference Assessment of Satisfaction. So Alex is going to do a short little demo on Compass. And we'll also share with you our quality improvement resources in terms of if you're interested in doing a quality improvement project. We have some resources on our website that you can follow. And then Karen's going to talk to us and give a very clear, concrete example of how these resources have helped one organization in particular. When do we want to do the Zoom poll? Should we do the Zoom poll now?
Let's do it.
Yeah, I think it was launched. So if you haven't had a chance to check out our poll, it's already launched. Looks like we have some responses.
Great. Yeah, so please let us know what setting you're in. So I see we've got, and we'll share these results with you. So we've got a few in nursing homes. We've got some in home and community-based. We've got some that are in serving as direct care positions, some that are in director and leadership. We've got social work, life enrichment. So go ahead and take another minute or two just to answer the poll. We have about 50% who have participated. So if you can complete that, that would be great. And then Alex, whenever you want to, feel free to share those results. I'll keep going. I'll talk a little bit about preference-based living. So the recommendations that we're going to be presenting to you are based on the experience and expertise from over 20 years of research, development, testing, and implementation of the Preferences for Everyday Living Inventory, or PELI, in various organizations. And so the goals that we have are to assist providers in practicing preference-based, person-centered care. Our belief is that you are not the only ones responsible for person-centered care, that we can have a role to play in that as well, that we can support your efforts. We want to support your efforts. You can tell us a pain point, and that gives us great information to go and figure out how can we resolve this pain point, and then work with you on solutions and testing those solutions, so that we're doing some of that behind the scenes work, so that when we give you a product, it's been tested and you know it's going to be worth your time and effort.
All right.
You want to go ahead and end the poll?
Yeah, so it says stop sharing. So am I sharing? I don't know what you're seeing. What you're seeing.
You know, I see the results, but I don't know if everybody else sees them. Maybe we'll respond that we've got about 67% from the nursing home, 33% from home and community-based care, 67% of you are director of leadership, and 33% are direct care. 33% are social work, and 67% are life enrichment. So that's great. So welcome. Thank you all so much for, participating in our poll. So next we want to talk to you a little bit about this is our big, hairy, audacious goal, right? Our person-centered care systems goal. And the idea behind this is that we think about things in terms of processes and outcomes. And so obviously you need some training around using the PELI and administering the PELI in order to understand what people's important preferences are. And so we have a lot of resources around how do you talk to the individual? If the individual isn't able to communicate with you, how do you then talk to a proxy respondent, maybe a family member or friend? And if there aren't family or friend available, how do we then maybe capture the observations of staff to say, well, they smiled when I did this, or they really resisted care when we did this, as options and input into what might be a preferred activity. Then we also have tools around care planning and how do you communicate important preferences across different departments, different shifts. And then how do you match the programs that you're offering to those important preferences that folks have? And then how do you finally wrap it all around and look at measuring of your outcomes and how well you're doing? And in terms of a performance improvement project, either a PIP, maybe you're familiar with the QAPI resources, so the quality assurance performance improvement, or simply quality improvement projects. Many of you are not going to be surprised to know that person-centered care and preferences matter for many reasons. But to be brief, person-centered care seeks to understand each individual's preferences, goals, and values, and to honor them throughout the care delivery process. When we understand an individual's important preferences, it's one way of providing person-centered care. So person-centered care is a big umbrella term, but in every definition you will read, knowing the person, understanding their preferences is in every single definition. It's a crucial part of person-centered care. So that's the one sliver or slice that we're providing to you here today. We know that when care team members can anticipate individual needs, they can work more efficiently. They can spend their time where it has the greatest impact to that individual. And when preferences are understood and honored, people have a greater sense of autonomy, improved quality of life, and emotional well-being. So what is the PELI? So for those of you, I'm trying to think, it'd be great if we knew, if you could let us know. I'm trying to think if there's a way, if they have the ability to do a little thumbs up. If you've heard of the PELI, give us a little thumbs up or let us know in the chat. Oh, great. Yes, Great, Alicia, Abby, thank you. Yeah, raise your hand. That's it. Raise your hand. Let us know if you've heard of the PELI. Fantastic. And so great, Melissa has, wonderful. And so just thinking through sort of how much detail to give you. So we've got several people who have heard of the PELI, but we have as many who have not. So I'll tell you a little bit about it. It stands for the Preferences for Everyday Living Inventory. And it's a questionnaire that's used to learn more about an individual's most important preferences. We have a range of domains of questions that we ask, and I'll share those with you in the next slide. In order to facilitate quality improvement, the response options are on a 4-point scale, where this is not an important preference at all to it's a very important preference. The information that you gather using the PELI can be incorporated into care planning and quality improvement efforts, and it's evidence-based. So it was originally tested in over 550 older adult home health recipients, and then we received additional funding to revise it for the nursing home population. And so this is guided by the voice of the older adult who's receiving services. And so again, it's grounded in what's important to individuals. There's 72 total questions, because each time we would ask folks what's important to them, we would go through a litany of questions and then say, well, what else is important to you? And they would tell us one more thing. And so we kept asking, well, what else is important? And when people finally said, you've hit it all, then we stopped. Now, this is not a composite scale, if you're familiar with those, where you might have to use all of them. Each question stands alone. And so you can pick questions that you want to use from among the 72. 16 of the items are consistent with the MDS section F, if you're familiar with that. And here are the domains. So there's a social contact domain, there's a growth activity domain, a leisure domain, a self-dominion or autonomy domain, and then caregivers and care. And so you can see that it ranges from questions about who you'd like to spend time with, what topics are interesting to you, would you like to be involved in cooking or taking care of pets or gardening? How would you like to care for your hair? How would you like to, what clothes would you like to wear? And how would you like your care, who would you like to deliver your care? Is your daily caregiver a male or female? Is that important to you? As I mentioned, we have an exhaustive amount of research making the PELI the only, one of a very few evidence-based preference assessment tools that exist. We have over a dozen peer-reviewed articles. We're willing to share those with you. If you're interested, just let us know. And we have been funded by many organizations who have believed in us and believed in the work. So the opportunity to build relationships is one of the biggest reasons why we recommend doing a preference interview, because this is a time when you stop and you say, what matters to you matters to me, and helping me understand what matters to you will help me deliver better care to you. And so some folks are so tired of being assessed and having to answer so many different questions that they get to this and they're like, oh, please leave me alone, stop bothering me. But again, it's important to remind them that this information is crucial, it's foundational to being able to plan their care and their daily activities in ways that matter to them, in ways that bring meaning and joy to their lives. And again, remembering to thank them for their time at the end of a session. You don't have to complete an entire assessment in one day. You could ask one question a week. So there's lots of different ways to go about it. And let me share a couple of items with you. So for example, how important is it to you to choose when to get up in the morning? And then you'll see that somebody could say, well, it's very important, somewhat important, or it's important, but I don't have the choice or I can't do it. And if they answer one of those importance, then you need a little more information in order to guide the plan of care. And so then we need to ask, well, okay, well, what time would you like to get up in the morning? And then you can record some details around that. If it's not an important preference to them, you move on. You don't need to know any more about that. How important is it to you to have regular contact with friends? Similarly, you can see here, if it's important to them, well, who are the folks that you want to have contact with? And it might be important to know who they don't want to have contact with as well. And then again, if it's not important, we move on. So how important is it to you to have staff show you respect? And this is a tricky one. So everyone wants to be shown respect. I don't think anybody's going to say, well, that's not at all important. But in the ways in which they want to be shown respect will vary. So for example, I might want to be called by my first name. Alex might want to be called more formally, by her last name. Somebody might prefer that, knocking before you enter is a sign of respect, or somebody else might see that as not needed. So again, understanding in what ways you feel respected is important in capturing for folks. And so this question really gets at that. You all are probably familiar with how important is it to you to listen to music you like? Well, that might be very important, but boy, if somebody wants to put heavy metal on, I'm not interested. And so again, we have to know what kind of music. And so the PELI helps you understand a little bit more detail around that. There are many, many providers who use the PELI. It can be used at no charge. It was developed with funds in the public domain, and so we are committed to allowing this to be useful at no charge. It can be administered by a range of folks. It can be professional, paraprofessional, family members, guardians, even volunteers. Prior to COVID, we had organizations that used volunteers exclusively with their PELI assessments. And we have some training videos that can be useful, because we wouldn't say that this is an unskilled activity. Interviewing somebody about their preferences, if they have a speech difficulty or if they have dementia, is very much a skilled activity. Centers for Medicare and Medicaid Services recognizes the PELI as part of the dementia care survey tools. The National Nursing Home Quality Improvement Campaign had a person-centered care quality improvement goal that focused on the PELI, and the Greenhouse Project uses the PELI. So there's lots of organizations that use the PELI. All right, so where can I find the PELI? We have all of our resources on our website, and Alex is going to be dropping in links in the chat as we go so that you can click on and go right to that webpage if you'd like. But again, we have all of our resources are at preference-based-living.com. And right now we have 3 versions of the PELI that are available. So the first one is the most comprehensive one. We call it the PELI Nursing Home Full. This has all 72 questions plus the detailed follow-up questions. We also have the PELI MDS Plus, which is contains the 16 PELI, the 16 items from Section F, plus those nested items where you get a little bit more detail. And then we also have the Rainbow PELI, and this was developed in partnership with many organizations such as SAGE that addresses the needs of lesbian, gay, bisexual, and transgendered older adults who are residing in nursing homes. And we can also customize a version. So if you look through the PELI and you find 10 items that you want to use, let us know. And we can create an interview guide with just those 10 items and send it to you. So please let us know about that. And thanks, Alex, for putting those links in the chat. How does the PELI help you? How does it help? It supports your care planning and delivery of individualized care that meets each person's psychosocial and physical needs. As I mentioned, it guides staff training, accelerates quality improvement, and aligns services more closely with expectations from consumers, families, and regulatory agencies. You're all mandated to provide person-centered care. This is one way you can show that you are. Also, using the PELI provides an opportunity to get to know the individual and to build insights, relationships, respect, and trust. And so again, it's a tool to say, you matter, I want to know more about you, and this is a systematic way to do it. Okay, so one recommendation that we have is if you're not very familiar with the PELI, download the 72 item version and look through it. Review the questions. You could pick 10 questions, and I'm just picking 10 out of a hat. It could be 5 questions. For example, we had one provider come to us who wanted to improve their satisfaction with food. And there are 6 items around dining preferences. You could just pick those and focus on those 6 items as a quality improvement project, for example, or just an initiative for a year. Maybe you want to pick questions that speak to your mission, vision, and values. Maybe you have organizational goals or areas that you want to improve. Maybe you want to move it, you want to improve the move-in process. Maybe you want to improve your activity programming. So there's many different ways to approach this. And again, we're here to help consult with you to do that. Just reach out. On our website, we have a variety of resources available, from tip sheets to training videos, and these are professionally produced. We have toolkits. We have virtual seminars like this one and webinar recordings that we make available. We have quality improvement projects that you can just pull right off the shelf and implement. We have an online training program on emotion-focused communication. And as I mentioned, we have Compass. And so I'll tell you a little bit more about each of those in turn here. So here's the link to our tip sheets. And you can see we have a whole range. I'll sort of hit some high points. We have tip sheets around how do you get started? How do you interview? How do you work with proxies? We have guides around helping staff engage. We did some research around, well, what are the top 10 preferences across residents who are living in both nursing homes and receiving services in home and community-based settings. And we saw a lot of alignment on those top 10 preferences. And so that might be where you want to start with your preference questions. Maybe you're trying to integrate preferences into care plans and you're struggling with those I statements, or you're struggling with how do you create goals and how do you make sure that you keep them broad enough so that you don't get in trouble when you have a surveyor come. So we have those options. Perhaps you serve a lot of short stay residents. We have tips on how you engage short stay residents with the PELI. We have sample policies and scripts and some sort of best practices like this As You Wish program and honoring preferences during quarantine. So we have a ton of tip sheets that are all available to you in terms of what your unique interests may be. We also have a customizable brochure, and many of these resources came from you. You said to us, well, people are asking me why they're being asked all these questions. We need a brochure that we can include in a move-in packet that we can hand them. So this is something you can download, you can customize with your own logo on the back, print it out and put it into your materials, or hand it to somebody as you're about to start an interview. We have a whole set of training videos around why preferences matter. This is a short little 3-minute animated video about why preferences matter. We have interviewing older adults, so that this is a 20-minute video that you can use to train folks to use the PELI to learn how to do interviews. And Alex is dropping these into the chat box as I'm talking. We have how to engage family and friends. How do you integrate preferences into the care planning process? How do you plan for honoring preferences when that choice involves risk? This is a whole toolkit that we have. And then we have some training videos around how to deliver the individualized positive psychosocial intervention, or IPI for short. So I mentioned this toolkit, and this is a fantastic resource. So for example, if you might have a resident who loves ice cream but is also diabetic, how do you, and they want ice cream every night with dinner, how do you plan for that, but also mitigate the risk that that may have to, their clinical outcomes? So we have a training video and facilitator guide. We have a webinar where the creators of this toolkit come on and walk you through it. We've got a tip sheet and a spotlight on risk. And so again, if this is a particular area of concern, go here. I would say out of all these resources, just know that we have them, but pick the thing that's the most painful thing for you right now, because that's where we want to ease the pressure, is using some of these resources to help you out. As I mentioned, we have tons of webinars and virtual seminars. We do these quarterly, and so we have several that we've hosted. We also are willing to present to any audience that you might have, and we've done that at other, for other organizations. And so thinking through here, you might want to know more about the Rainbow PELI and addressing sexual orientation and gender identity. We have that stored on our website. One of the things that we're most excited about that came out this year is our emotion-focused communication training. So as I mentioned earlier, caring for a person living with dementia is not an unskilled task. This is something that requires a unique set of skills and particularly psychosocial skills. And these are not routinely taught to any of us, but most importantly, to our direct care workers. And so lacking some of these skills, such as listening actively or recognizing emotions, they may find it difficult to provide care. If they can't, for example, see that somebody is restless because maybe they don't know what to expect. And so having some strategies for communicating with folks can help, again, make the care delivery process much more enjoyable. And so we developed this professional certification with the goal of increasing the competency of caregivers' emotional intelligence skills. So this isn't just for a direct care worker. It could be for anybody. It could be for a family member. So you can recommend this to your families. You can recommend this to your staff. The concept of it is centered around emotional intelligence. So you've probably heard of IQ, and this we think about as EQ. And so again, how do you recognize emotion in others? And as caregivers are faced with conflicting demands to be both efficient and nurturing, it can be very challenging. And what we know is that we must first care for the caregiver before we can expect the caregiver to be sensitive to the care recipient's needs. And we know that people with high emotional intelligence understand what they're feeling, stop to think before they act. They're not reactive, right? They pause, they stop to collect themselves with a response instead of a reaction. And they have strategies to change negative feelings into positive ones. And all of us can increase our emotional intelligence by working on these skills. So we developed this course as part of our IPI intervention, which I'll talk about again in a minute. And it's one of the training components for the IPI. And the goal, as I mentioned, is to increase staff competency in managing both their emotions and other people's emotions. The IPI is an evidence-based program designed to support caregivers in engaging people living with dementia in positive ways. And the idea here is that we take a preferred activity and we train a direct care worker to deliver this in short, small little increments, no more than 10 minutes, so that if there's a time of day or an activity where the person might communicate more distress, this is something that a caregiver can pull out of their back pocket and use to reduce that communication of distress, whether it's anxiety, persistent vocalizations, agitation, wandering, any kind of other disruptive behavior. With the course, we hope that the expected outcomes are to learn what emotional intelligence is and increase your emotional intelligence. And we've had over 130 people go through the course already, and our pre and post-test results show that this is in fact the case. We see statistically significant increases in both knowledge of recognition of emotions and the use of strategies to communicate. So we're really excited about that. We hope that it can help identify one's own feelings in response to an event, so that when somebody, for example, lashes out, that you recognize that and are able to think about a response instead of reacting. We hope that it helps somebody understand how a person is feeling based on their body posture. And as I mentioned, replace a negative feeling with a positive one. We hope that it increases skills in recognizing emotions in others and in handling emotions in others through active listening, and use positive communication to handle emotions in others. And you do get this beautiful certificate of completion when you go through the course. It's part of Miami University's learning management system. And so we'll share with you how you access it. You use this link. You add it to your cart, so it'll show as $0. You still have to check out, but you don't have to enter your credit card information. And then you'll be given a login to start the course. And the course takes you through, there's 6 modules that each take between 15 to 30 minutes each. So plan for around 2 hours, 2.5 hours to complete the whole course, but you don't have to do it all in one sitting. All right, And then the last couple things I'm going to talk about before turning it over to Alex are quality improvement projects. So these are a couple of quality improvement projects that are focused around the Plan, Do, Study, Act cycle. The first one is our IPI QAPI. And here we have on our website, we've laid out in those buckets what the IPI is, what the value proposition of doing the IPI is, as well as how to go through the Plan, Do, Study, Act stages. And so that's available for you to use at any time at no cost. If you would like consultation, please reach out. PAL cards, we haven't mentioned, and hopefully I'll have an image of that in a minute. PAL cards stand for Preferences for Activity and Leisure. And the idea behind this came from a provider who said, I want to communicate important activity and leisure preferences on like a Cardex on the back of somebody's wheelchair. And so we developed these small 5x7 cards that can be personalized and tailored to an individual so that it can live with them wherever they go and can help start a conversation. I'm going to see if, oh, good, we've got pictures. So let me show you the PAL card and then I'll flip back to the IPI. So here's an example of a PAL card in action. You can see that it can be connected to somebody's walker or wheelchair. And this helps because you want that information close to the person. It doesn't help if it's in a binder at the nurse's station. This way, a volunteer can walk up and say, hey, Jackie, it's so lovely to meet you. I'm Katie, and I see that you love 60s rock. I do too. Who's your favorite band, right? You love Neil Diamond. What's your favorite Neil Diamond song? And so it's just a way to ease that ability to have those conversations and have a meaningful conversation and interaction. It can also be useful if somebody, again, is communicating distress as a way of redirecting and having a conversation about the Apple Butter Festival that they love to talk about. This is an example of the IPI, where we have over 70 different types of activity protocols developed. You can see the gardening activity one here. It walks you through how to start an IPI, the meat of the IPI, what to do during the middle of the IPI, and how to close an IPI. So using good communication skills, and then there's a way to evaluate it, asking the individual before and after if they enjoyed this activity and if they'd like to do it again. So that gives you data to know if you should continue doing this or if it's something you should de-implement. All right, so at this point, I'm going to stop and I'm going to turn it over to Alex to tell us more about Compass.
Awesome. Thank you, Katie. Alrighty, so what is Compass 16? So Compass stands for Care Preference Assessment of Satisfaction, but we call it Compass 16. It's a web-based application that offers a simple and efficient tech solution to long-term care providers. So Compass 16 allows providers to ask nursing home residents about their preferences for everyday living and document that information for easy sharing among care team members. The system contains the 16 questions from the Evidence-Based Preferences for Everyday Living Inventory, or the PELI, as you have come to know it now, that are consistent with Section F of the MDS. And so in addition to those Section F questions, Compass 16 includes the nested items from the PELI that dive deeper into those details of a resident's important preference. Compass 16 also allows providers to track resident satisfaction with the way that their preferences are met over time and offers graphic reports that show care team members at a glance how well they are providing preference-based person-centered care. These reports help communities in identifying opportunities to improve care delivery. As we know, knowing what's important to residents and how satisfied they are with their care supports both preference or person-centered care planning as well as data-driven quality improvement efforts. So the system can also generate preferences for activity and leisure cards, or the PAL cards that Katie just showed you, which is a great tool to communicate preference information. And so I'll show you how to do that with Compass in just a moment here. All right, thank you, Katie. Okay. So the web-based application is compatible with a variety of devices. So it can be used on a smartphone, on your tablet, on your laptop. Really all that's required is an internet connection. Care provider accounts can be set up to reflect your community's organizational structure, and you can assign user types with varying levels of access as appropriate for different care team members. There's also open text fields in the app that improve efficiency in recording residents' comments about their specific preferences. And then the printable reports enhance the ability to share this preference information among care team members. Compass 16 also includes the mandated Section F items with the follow-up questions from the PELI, like I mentioned. And so this is important because the MDS really only asks that STEM question of how important is it to, be around animals such as pets, but it doesn't really provide any probing questions to help you gather that really valuable information that's really actually going to help honor that preference. And so, so that's why that combination of having, the MDS questions with the PELI follow-up questions in there to really get you some robust and comprehensive information that's going to help honor those preferences. Alrighty, so I'm ready for the next slide. And so, so now I'm going to do a quick demo of Compass 16 features. And so, I'll kind of address some of the challenges that we hear from providers that the app can help to alleviate. And so some of those are gathering enough information from the section of questions, prioritizing what goes into the care plan, assessing satisfaction with preference fulfillment, and communicating important preference information. So if you give me just a moment, I'm going to share my screen and show you what I'm talking about. Alrighty, okay. Are you seeing the Compass screen? Thumbs up? Okay, perfect. Alrighty. So, for the first thing you mentioned, so gathering enough preference information. So one of the struggles we hear is that, Section F just barely scratches the surface when it comes to what we need to know about a person. But then we also hear sometimes that the 72-item PELI is just overwhelming for some providers. So that's why we really, so we took that into consideration when developing Compass. And so that's why we landed on the 16 questions with those follow-up items. And so here is an example of what the interview screen looks like. So if you can see over here, so this is the list of all of those 16 questions from the MDS. And so this is what the interview screen looks like here. And so you'll see that there's the F tag, here's the C question. So you'll ask the resident, how important is it to you to choose what clothes to wear? If they say it's very important, then you'll see these prompts to ask more questions, to gather more information. And you'll type your responses into these text boxes here. What do you like to wear today? Sundress, since it's sunny out. And then you'll hit next and it'll save the information that you entered. And so say somebody says, it's not really very important for me to take care of my personal belongings. I'll report not very important. You'll see the nested items don't show up because we don't need to gather more information about this preference, and then we'll move on. And so then you'll kind of go through that process of asking questions and gathering more information for those important or somewhat important preferences. And then once you've completed that interview, then Compass will generate for you what we call a preference report. So I'll show you here. And so this is really great because typically when you do the assessments, either paper and pencil or maybe in the electronic medical record, it doesn't really give you a nice report of what's important. And so Compass allows you to do that. And so the preference report is organized by the very important preferences first. So you'll see here, it's very important for Lois to choose what clothes to wear, but then we'll also see all those details that we need to know to help her honor that preference. And so it'll go down to see some other important preferences that she has. So she looks like she's got a lot of very important preferences, and here are her somewhat important preferences. And so then this report, so this is what it looks like on the web page, but then you can also, you should be able to export it as a PDF. And I think I missed that part, but okay. And so that's the preference interview and then the preference report. But then as I mentioned too, Compass can also help you assess satisfaction. And so I'm going to show you what that interview looks like. So you can see that the interview screen is very similar. The big difference though, I will show you is, so this is after we've already interviewed Maria. We've already asked her important preferences, maybe for her last care plan. Say her quarterly care plan is up, so we want to see how we're doing and use that information to inform our discussion. So we'll circle back to Maria and ask her the same questions. So she said, last time, how important is it for you to choose what clothes to wear? Say she still says it's somewhat important. Then we'll ask her, since it's either important or somewhat important preference, then we'll see the satisfaction question. So this is something that's important to her. It's important to us to know if we're getting it right or how we can improve. And so we'll ask her the satisfaction question, which is how satisfied are you with this preference being met in the past week? And so she'll respond, you know, maybe somewhat satisfied. And then you'll, you know, go through the interview the same way. And so once you've completed the satisfaction interview or this follow-up interview, then you'll get this lovely satisfaction report. And so you can see here this lovely pie chart, pie graph here of what's important to her. And so the green are those important preferences. So the preferences that she reported as being important that she's very satisfied with. And so we can look at the drop-down menu here and we can see those preferences. So those are the ones that we're, that are important to her that we know we're doing a good job at honoring. And so, as you can guess it, the yellow ones are the important preferences that she's somewhat satisfied with. So again, the drop down will let us know which preferences those are. And then the red are those important preferences that she's not satisfied with how those preferences are being met, or maybe we're not currently meeting those preferences. And so what we like to say about kind of the color coding here is that we don't want the red or yellow to be scary or off-putting. These is really how we kind of know where we've got some room to grow and to improve in providing her care. So the green, we obviously want to celebrate that success and keep going on those things, but then the red and yellow is really just opportunity areas. So this is how we can further tailor Maria's care to help her be more satisfied and to enhance the person-centered care delivery that we're striving for. And so, so those are the preference interview and preference report, satisfaction interview, and the satisfaction report. We also have a satisfaction report at the neighborhood level. And so once you enter, residents into your account, and then you can organize them by neighborhoods. And so we can kind of scale that satisfaction information up and see how satisfied, one of our neighborhoods in the community is. And so this one looks like everybody is, for the most part, really satisfied, but we do have some opportunity areas over here. So just like the other report, you're able to click on the color, and then you'll see where they're unsatisfied. So let's see. It looks like we can maybe improve satisfaction or enhance our person-centered care delivery by looking at folks' favorite activities and see what's maybe not being offered. Looks like a lot of people in this neighborhood like snacks. So seeing how we can, maybe the snack cart needs a different menu or something like that. So kind of diving in deeper here. And so this will really help, like I said, give you some opportunity areas. So if we're really striving to enhance our person-centered care, this can clue you in on where to start. Alrighty, and then last but not least, I mentioned that we have what we call the PAL card editor. So if you'll go to our website, you'll see that we've got resources to do the PAL card paper and pencil, but we're already collecting this information in Compass. So what we did was create an editor. So if you remember those text boxes, so, and maybe actually I can go back and show you. Yes, so let me do this real quick. So for the activity preferences, so being with animals is one of them. So you ask, how important is it to you? This person says very important. And then down here you'll see, so on the activity preferences, there's this little checkbox that says include on PAL card. And so you'll check this box, and then any text that you type into this box will be pulled into the PAL card editor. So now this should make a little bit more sense. And so here is all of that juicy information that you gathered during the interview, all in one place to help you create the PAL card quickly and efficiently. And so, so all that you have to do here is, let's do a new one. Drag and drop into one of the boxes. I'm gonna go down here. Where did it go? Nope. There we go. And so you'll see it'll pull the heading and the text. You can add some more text here, and type in different things. And then this is where you type in the bio. And then you could do print preview, which I hope will work for us. Yes. And so then here you go. So you can see her PAL card, and then you're able to download that as a PDF and then display it wherever the resident chooses. And so, okay. So I think that's everything that I wanted to show today for the Compass demo. So we go back to the slides. Oh, do you need to stop sharing? Okay.
Yeah.
There we go. Sorry about that.
That's okay. We've got this. All right. Let me share our slides again.
right.
All right, so that was the demo.
That was the demo. And then I was just going to say before I hand it over to Karen, how to access Compass. So, we partnered with Link Senior to help offer Compass at no cost to providers, as well as we've got some generous grant funding from the Ohio Department of Medicaid. So you can use this link, and I'll drop that into the chat here as soon as I hand it over to Karen. To access Compass, you can set up an account and kind of play around in there and get comfortable with it. At no cost to you. And then I'm also happy to do a private demo for your team on Compass and answer any questions one-on-one. And so there's a link for that as well that I'll drop into the chat. And so, with that, I will hand it over to Karen from Abramson Senior Care to share some examples about how they use preference information. Thank you so much.
Thanks, Alex. And I dropped the links in already. Go ahead, Karen.
Thank you so much, Alex and Kate. Alex, that is amazing. I love the Compass tool. Every time I see it, I get so excited, just how flexible it is, not just restricted to nursing homes, but providers from other community, business lines can access so easily that tool, and the resources available, unbelievable. So I get blown away every time I see you do a presentation. It's really exciting. So yeah, thank you so much for having me to join the webinar today. I'm so delighted to kind of share to you our example of how PELI kind of has come to the rescue for our organization. So Abramson Senior Care, we're a nonprofit organization, senior care agency, and we're in the Philadelphia area. So for many years, our organization, we championed the PELI as a tool to helping our teams with innovative ways of delivering person-centered care. So over the years, we successfully implemented the PELI on 3 of our business lines: skilled nursing, assisted living, and our adult day services. And on each of these lines of business, we developed innovative ways of using the preference information for developing a person-centered system of care. And I'll kind of go through what that means, a person-centered system of care. We found that by taking a data-driven approach to improving quality of care, that it really helped us developing resources and tools that empowered our teams to come up with solutions for enhancing person-centered approaches. So for example, we use the preference information we routinely collected, like you saw shown here on this compass. We use the expanded version of the PELI for similar PAL card reporting, which highlighted preferred activities and routines, but also it gave us the potentiality for developing robust preference-based recreational programming. And if you think, each business line had different preference profiles, so the recreational programming that we developed was customized for the particular residents in that population. Seniors who are in adult day may have different preferences than seniors in assisted living. So we were really able to leverage that preference information for knowing what were commonly held patterns of preference information on the business line level. So our goal then was to build, as I mentioned, to build this recreational programming based on the commonly held preferences on both a neighborhood and a community level. And really the value add-on of our QAPI initiatives came to full fruition, and the PELI came to the rescue when we were in intense periods of pandemic lockdown. And the recreational teams, they were quickly able to pivot from providing group programming to individualized person-centered care because they knew what were the preferences of the residents. On this preference-based living website, you'll see this QAPI resource will be available, in terms of a tip sheet for helping you to think about using PELI in your QAPI program. And it's a really great resource for helping your team to think about starting a preference-based QAPI project. Next slide, please. So the very initial reason why we wanted to start a QAPI initiative was to really focus on meeting resident preferences to kind of help with communicating to caregiver important emotional well-being and daily routine information prior to a person's admission to the nursing home or assisted living. Our experience was that without this information, there was a lot of trial and error in trying to figure out best care practices to mitigating emotional distress for our residents with dementia. We found that the more we systematically learned about resident preferences, habits, and strengths, the more we were able to proactively integrate this information into care planning for developing effective non-pharmacological interventions for combating depression, managing behaviors, falls management, etc. Next slide, please. So what happens in a QAPI project focused on preferences in person-centered care? Our teams found that having a QAPI project, there were many benefits, including using the PELI to assess preferences routinely and integrating the information gleaned from the PELI assessments to craft more personalized and successful resident care plans. As our teams became more sophisticated in using the preference data, we gained competencies in auditing care plans and evaluating the extent to which our programming was person-centered. So one great practical example was that through our QAPI project, we were able to develop binders available on every household, which had a one-page summary, which highlighted what was important to the person. Very similar to that PEL card that Alex just demonstrated. Our recreation team ensured that our binders were kept up to date. And for many reasons, we had to have them in binders, over having them on the wheelchair. However, having this preference information available, our recreation staff was able to work with our teams to develop activity kits. And then the purpose of these kits was to assist our night and weekend staff with ideas for successful ways to engage and stimulate residents. Next slide, please. Next, thank you. So the preference-based QI initiative was an interdisciplinary collaboration effort between multiple departments that we gradually evolved a robust infrastructure to demonstrate that we were providing person-centered care. So you see that within this person-centered care system, the first step was clinical assessment, knowing important preferences. And then we looked at how well we were honoring those preferences in the plan of care. And then we looked at process measures such as, our residents attending preferred activities. And then we looked at satisfaction, or an outcome measure in terms of our resident benefiting from the preferred activity. So our experience was that the most important step was in the clinical assessment phase, and we developed audits for systematically collecting the preference data of all residents in our residential and community-based populations. We enlisted residents and families to complete the expanded PELI assessment during the pre-admission admission process. We provided training to our staff for tips on how to optimally complete the PELI interview. As additional resources such as volunteers and students were available, we would involve them in the interviewing process. Staff and volunteers alike found the interview process to be an enriching experience, and our staff developed really creative ways for the PELI assessment process to be conversational and engaging. Next slide, please. So key to our success were that our executive and management teams all valued the PELI as a priority quality of life programming. Key to management embracing the PELI was the central notion that this is not a task for task's sake, but it was an important relationship building activity. The information that was gleaned out of the interview assisted with spelling out to the care team for how the person wanted to live their life in the setting that they were receiving care. Of course, though, there are several important resource considerations, such as this, time needed for staff across shifts to participate in committee meetings, collecting and analyzing the data, conducting the resident assessments, and care plan activities. But we found that, in the long run, that, the time that we invested, that we got so much more out of it that, it just became a part of the way that we provided care. Next slide, please. So one of the first important steps is creating a PELI committee. And they're really involved with helping to kind of like craft the structure of the project, thinking about planning, launching and coordinating the initiative. Ideally, the committee should involve team members across shifts and departments, as this is truly interdisciplinary. We had IT involved in our PIP committee because they were really, instrumental in helping to, to enhance our EMR systems. But of course, committee members, they should be, passionate about honoring resident preference and choice, able to serve as effective advocates, working very closely with employees or volunteers who conduct the resident interviews. And so, really important in the process of creating the PELI PIP is having a champion. The champion is so important for kind of helping to keep the PIP together and, really, coming up with new ideas and, a sounding board as, the committee is launching new tasks. So I think we can just kind of glide through the next couple of slides. This is just, some more information of where to get started. But Katie, if I could just kind of turn it back to you so we can see what questions there are. Of course, here's the Quality Improvement Model Plan, Do, Study, Act, which is always helpful in any, in any performance improvement process.
Wonderful.
Right, Katie.
Thank you so much, Karen. So we want to just let you know as please drop your questions in the chat. We have a few minutes. We'd love to be able to answer them. As you're doing that, we'll kind of give you a little bit of our commercial. We're on social media. We'd love to have you join us. So please connect with us either on Facebook, on Twitter, or on LinkedIn. And on our website, when you go to our website, you should get a pop-up that allows you to sign up for a monthly newsletter. And so we will please, sign up for that. And we only send one email a month and we do not share your information. We're very protective of that. We also want to build partnerships with you. We seek to create opportunities for providers to interact and learn from one another by sharing successes and stumbles. If you've done something really well, we want to highlight that and share it with others. If you're struggling with something, let us know, because we've likely talked to somebody who's had the similar struggle. We also want to know about any barriers or facilitators that you've had while using the PELI, because again, anything that you struggle with, we want to know about so we can help remediate those barriers. And then let us know if you have additional questions as your organization might begin implementing the PELI, because we'd love to be able to consult with you. And so please let me know if you have any questions. I'll end here with our email addresses. If you have any, if you'd like to reach out to us, these are our email addresses that you're welcome to reach out to us. And then let's see, do we have any questions? I know we're almost out of time and I'm sure everybody has to get to their next meeting. All right, I don't see any questions right now. And since it is almost 2 o'clock, I just want to thank you all for your time and attention. Again, we want to work with you. We want to support you, and please reach out, and we'd love to develop more partnerships. Again, thank you all so much. Have a great rest of your day.
Thank you, Alex and Katie.